I personally have witnessed the effects of electroshock therapy, which was done on a friend of mine, and she suffered from memory loss for several months. So it is my position today to stand here and convince you of the realities and the unhumaneness of electroconvulsive shock therapy. Let us take a look at the origins of electroconvulsive shock therapy. Electroconvulsive shock therapy was first developed in Rome in 1937. Electroconvulsive therapy is shortened to the term electroshock therapy, but today we're going to call it ECT because that's what it's normally called. According to N.S. Endler, 1988 ECT, The Myths and Realities, ECT was first discovered by Italian neurologist Ugo Cerletti and his colleague Lucio Vino, using the notion of electricity as a substitute for metrozole in convulsive therapy. ECT was performed for the first time on human subjects in 1938. But by the 1940s and 1950s, ECT was a common procedure used in psychiatric procedures in hospitals for patients who were considered otherwise non-responsive to regular psychiatric therapy. David J. Pittman, 1998, Psych Central, in the journal Risk and Side Effects, says that it was often used to control patients instead of to cure patients. So they would take the patients that were causing the most trouble in the hospitals and they would give them ECT because it would sedate them for several days. Today, the methods used when applying ECT are more humane, and but the basic techniques are the same. In the past, patients had electrodes hooked up to their head, and up to 750 volts of electricity were passed through their brain, causing horrible convulsions, which lasted up to 30 to 60 seconds. In the years between 1940 and 1970, these procedures were performed several times a day in psychiatric hospitals all across the USA. But today, even with these procedures being more safer, there's still a lot of dangerous side effects that go along with them. So let us look at some of these dangerous side effects. Side effects from ECT can be seizures, short or long-term memory loss, brain hemorrhaging, dementia, and even death. The violent convulsions caused by ECT are followed by periods of unconsciousness, which last for several minutes to several days. Now, anyone that goes to the hospital with any type of depression or suicidal thoughts can now be immediately sentenced to ECT therapy. And that is stated by the Mental Health Act 2009, Mind Freedom. It will completely overrule anything that you have to say about this therapy because it is deemed best for you. After many years of decline of using electroshock therapy in the 1980s and the 1990s, it is now taken a foothold once again in the psychiatric community. In 1979, Dr. Peter Bregan, 2015, Psychiatric Drug Facts, published the first medical book that was advocating the banning of ECT. He also testified at the World Health Organization against ECT and the damaging effects that it has on the brain. Even the early pioneers in the field of ACT are in agreement that it can cause brain damage. So in conclusion, I would like to share a story with you about a former medical professional who had ECT. This is the story of Dr. Cheryl Stevens, who, although she has a medical degree, she is no longer practicing, thanks to ECT. After several years of suffering depression, which was not helped by medication or general psychiatry, she received several rounds of ECT. She now suffers from permanent memory loss, the ability to not recognize faces, and a lowered IQ. She also attempted suicide after an ECT treatment. She, along with many other professionals, believe ECT is a dangerous and inhumane process, which should be outlawed as a crime against humanity. Lethal side effects, not understanding how it works or does not work, and a shady past, these are the legacy of ECT. Should you or your family ever be approached to be given this procedure, inform yourself completely of the procedure of ECT and decide for yourself if the risks are still worth it. Thank you.